Hi Ron, how are you doing?
Good, you?
Ron was near the top of my list when I decided I wanted to participate in this grant. Have they said anything about your kidney function? Pulmonary fibrosis has no known effective treatment. My experience with it with other patients has been difficult. I mean, they've all had a slow, steady decline and ultimately died of lung failure.
I got to the point where I couldn't get my air oxygen level up. About 4 o'clock in the morning, I'd been sitting up in a recliner and my wife come out to check on me and she says, "Your oxygen is down in the 70s. She says, "We're not waiting." She said, "You're gonna be dead."
So as far as managing pulmonary fibrosis goes, a lung transplant is really the only definitive or curative treatment for this. The last consult note said it's not even worth referring him for a transplant because his weight is prohibitive.
At my highest, I was around 315 pounds, and I had to get down to a body mass of 30%. So I had almost 100 pounds to lose.
How are you?
Good.
I met Ron. Actually, he's my very first patient that I worked with as a care manager. How are things going? It's really easy as a healthcare person to tell people, lose weight, start exercising, decrease your salt, but it's hard for a person to implement those if they don't know how. And our goals aren't always the patient's goals, and that was a big part of it, is meeting a patient where they're at.
Kathleen was right with me right from the get-go when it come to me losing weight, and she kept in contact with me every day, every other day at least, trying to encourage me to keep going.
Some of the directions that I help facilitate Ron going towards is a pulmonary disease management program, which is where he would exercise to build up stamina twice a week. Also, he met with a dietitian to learn better eating strategies for weight loss. And another thing that he needed to address was applying for disability and dealing with financial concerns because he was no longer physically able to work at his job.
Over and above health coaching and goal setting, the care manager plays a big role in care coordination. People with complicated medical conditions have typically several physicians. They also often have other providers, therapists, rehab programs, and then the nightmare that comes with having insurance for things because it's, a lot of things need pre-approval.
And since I've had the new lungs, things are altogether different. 94% oxygen, 79. I'm 60 years old. Started my 60th birthday with a new life.
If we, as a society, have decided that the best health care is what we need to provide for folks in this country, we need to use the model that does that best. And the model that does that best is team-based care, coordinated care.
It's a great experience whenever you see someone succeed. With Ron's case, it was a huge success.
All I have to do is see Ron or think about him, and I feel good about what I do for a living. And without this grant and without our care manager, this never would have happened. And, we saved a life, and he got his life back.